sexually transmitted infections are really frequent, and we know that they also have these serious consequences, many of those affecting pregnant women and their newborn children. But we also see that they are incredibly stigmatized. So not only the infections themselves, but people who get them are also stigmatized. And particularly so for the bacterial and curable sexually transmitted infections. Even though HIV infection is more fatal, there is a policy community that is advocating for HIV as a priority. But in particular, there's a very widely held perception that sexually transmitted infections are actually receiving less priority than they have done in the past. And that's really why we decided that we needed to set up this multidisciplinary international project.
So what's going on at the global level?
Well, in our global policy analysis, which was led by our Chinese researcher, Dadong Wu, she looked at a framework for analysing policy. And one of the things that she found was that before the year 2000, sexually transmitted infections actually had a very high priority because they were seen as an effective method of reducing HIV transmission after a particularly large randomized controlled trial. But after that, subsequent trials didn't show that. And the priority seems to have reduced after that. And what our interviewers in our policy analysis found is that the policy community seems to have become less cohesive, and they do not coalesce around good solutions. But one of the things that we did find is that, surprisingly, there is money going into STI control. What we found is that there's money that is going into human papillomavirus vaccination programs, and there is money going into congenital syphilis elimination. But for both of those issues, they seem to be prioritised because the framing of the subject is not as a sexually transmitted infection. HPV vaccination prevents cancer, and it has a lot of traction because you're preventing a cancer that affects a large number of women worldwide. And for congenital syphilis, if you eliminate congenital syphilis by antenatal screening of pregnant women, you are saving newborn lives by preventing pregnancy losses and preventing the deaths that occur from congenital syphilis. So these interventions, they are effective interventions, but they really resonate with the community, and global agencies are funding those. Okay. So now I'm going to ask Lisa Vallely, who put together our qualitative work, what she found at the level of the country level in Papua New Guinea and Zambia. Hi, Lisa. So at the country level and as a qualitative researcher, what did you find out when you analysed the interviews with healthcare workers and program managers and pregnant women in Papua New Guinea and Zambia?
Yeah, it was really interesting actually, because there were some similarities in what we found that the pregnant women were saying and the healthcare workers. And basically it was around there's just not enough information given at the community level about STIs. And the women, when they spoke about STIs, they spoke mainly about syphilis and HIV, a few of them about gonorrhea, but there was really very little understanding of the other curable STIs. And again, when we spoke to the healthcare workers, especially those working clinically, there was a lot of talk about testing for HIV and syphilis, but less talk about other curable STIs. And what was interesting was there's a lot more testing for HIV because of the availability of the test kits, the rapid diagnostic tests for them. And in both Zambia and PNG, there was a call for more of the dual tests that test for HIV and syphilis, so that they're able to actually provide the testing for syphilis at the point of care when the women attend for antenatal clinic. And that was something that was really interesting for us to identify.
Yeah. Did the pregnant women say anything else, or did you find anything else about the views of pregnant women about sexually transmitted infections?
There was a lot of talk, again, from both healthcare workers and the women about witchcraft and STIs being caused by witchcraft. And then women not presenting to a health centre if they felt they had an STI because they wanted to go and see the sorcerer or the witch doctor beforehand to get their treatment, only presenting later on to the health facility when they realised that treatment wasn't working for them.
Right. Did you want to say anything about stigma in the communities?
Yeah, stigma in the communities was a big one really, and that's one of the reasons why women weren't accessing healthcare, because they were afraid of disclosure. Just by presenting to the clinic, they were afraid they were going to disclose that they have an STI of any description, including HIV and syphilis. But also as well around stigma was the fear of disclosure to partners, and in Zambia in particular, there was talk about gender-based violence if women disclose their status to their partners or their husbands, and there was a big fear around the disclosure of their STI status in those situations.
Interesting. Do you want to ask Matt some questions now about the work that we were doing?
Yeah, I'd love to ask Matt some questions. Thank you. So what I was just wondering is what are some of the challenges that you faced in conducting this research in Zambia and in Papua New Guinea?
Well, the first challenge was one that we did not expect, COVID-19. No one was prepared for that, but the research had to continue. And fortunately, at least in the case of Zambia, I know, because the work was embedded within routine antenatal care, we were permitted to continue. Other research projects were held up. They weren't considered essential. But one of the real challenges we faced was trying to bring together our Papua New Guinea and Zambian trainers. We had plans to have a true exchange, and ended up needing to kind of use the new tools of the day, Zoom. And so never before had we done kind of cross-continental training of trainers, but here we were doing it, and it worked very effectively. The interviews themselves, of course, were done face-to-face, and there's no substitute for being together face-to-face when you're talking with participants and so on about very, very sensitive matters. But the use of Zoom really opens up a great deal of opportunity for this sort of work moving forward, and that was a real plus. With that said, we had other challenges, and in fact, with the data collection, we really ran into trouble because of a number of issues, and Nicola can speak to that really quite directly.
Okay, thank you.
So I said that we had real problems with data collection. What can you say about that?
Well, Matt, as you know, one of our objectives was to make a complete estimate of the burden of sexually transmitted infections worldwide.
Yes.
And it turned out that that was rather over-ambitious.
Yeah.
We wanted, and we know that this burden estimate is incomplete. What we didn't anticipate was actually that the data sources that are being used and that the way that they're being synthesized has a lot of challenges that we found out along the way.
Yeah.
So we haven't been able to put together this entire burden. We want to be able to calculate how much of these sexually transmitted infections lead to death and how much they impair people's quality of life. And that's, for many of these infections, they most often don't kill you, but actually they impair people's quality of life. And we have a lot more work to do so that we can make better estimates for these curably sexually transmitted infections, and about how much of the burden of infections in pregnant women and their newborns, because those aren't quantified as well. And we need to add all of these in together. But that will be part of our future programme of work. What we have found out from the project as a whole is, with the data that we've collected and the policy analysis that we've done, is that to really raise sexually transmitted infections on the global policy agenda, we need three things to converge. We need a policy that is in place for an effective intervention that really addresses a well-quantified problem. And most importantly, we need a political situation to align with these other policy streams so that people recognise and have the political will to implement the change that we need to see. Nice
It's a tall order. It's a tall order.
It certainly is.
But
we have a lot of work to do.
We have to do it. Yes.
We have a lot of work ahead of us.